95% of the knowledge you need to see chickens, you already have as a dog and cat clinician. You can do everything the same. Blood pressure, the values are going to change, but how you acquire blood pressure is the same. ECG, you're going to do SpO2, capnograph. It's a great candidate for you to start.
Hey everyone, welcome back to Vetfolio Voice. This episode features Dr. Lila Proenza from Vet Ahead. We set out to talk about chickens and chicken medicine for the small animal practitioner who maybe is primarily used to seeing dogs and cats. And we noted how this is a really important topic because I don't know if this has been your experience, but I certainly feel that as more and more pet owners are taking on backyard flocks, many of us small animal general practitioners are being asked chicken-related questions that we may or may not have the answer to. So Dr. Proenza talked through how absolutely wonderful chickens are and how they can be a great gateway patient for someone who's just starting into avian medicine. We talked about tools that can make working with them a little bit easier, and I'll just give you a little spoiler alert here. You probably already have most of them in your clinic. And very importantly, she reminded us that we have to remember to comply with federal regulations regarding drug residues when choosing medications, even for the chicken that comes in a Louis Vuitton carrier. I can't wait. I can't wait for the day I get a chicken patient that comes in a Louis Vuitton bag. I will just make my day. And if you've ever spoken to Dr. Proenza or you've heard her speak, you know she's an incredibly insightful person with so much valuable experience. And she's so open and honest when it comes to sharing strengths as well as her stumbles or fears. She's really someone who's easy to connect to. So of course at times we veered away from chickens, and Dr. Proenza shared her story of having to step back into small animal practice after years in zoo med and how intimidating that felt, despite the fact that she's a brilliant practitioner who carries multiple professional degrees and is a board certified specialist with years of experience. I really appreciated her openness when it came to that experience, and it was such a good reminder that we're all just humans in this profession, obviously patients not included, and we're all trying to do the best we can and capable of so much as veterinary professionals. And also listening to her story drove home a point that Dr. Proenza has made clear time and time again, that the same systematic thinking we use for dogs and cats can absolutely apply to scaly or feathered patients and vice versa, as it turns out. I could go on, but you should hear it in her own words, so let me tell you a bit about Lila and we will jump in. Dr. Lila Proenza is a trailblazer in zoological companion animal medicine and the founder of Vet Ahead, a platform offering accessible online education in exotic animal care. Originally from Brasilia, Brazil, she holds both Brazilian and American veterinary degrees, along with a master's and PhD in biological and veterinary sciences. After earning her American veterinary degree in 2011, Dr. Proenza completed her residency in zoological medicine at the University of Georgia. She's the first South American to become a diplomate of the American College of Zoological Medicine, with an emphasis on zoological companion animals. Dr. Proenza is also known for her expertise in minimally invasive techniques and endoscopy, and was the co-editor of the 2015 Exotic Endoscopy issue of the Veterinary Clinics of North America. She's a dedicated educator, leading lectures, courses, and wet labs worldwide, all in the spirit of empowering veterinary professionals through knowledge in order to ensure that no species is left behind. All right, let's go ahead and get into it.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official Human-Animal Bond certification from NAVC and HABRI, the Human-Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at vetfolio.com.
Well, I'm so excited for this episode. Greatly anticipated, at least on my side, just to be joined again by Dr. Lila Proenza. Thank you so much for joining me. I'm looking at your background here, and it looks like the perfect place to record a podcast.
Right. Yeah, thank you so much. I always love to be here. I always love to talk to you. It ends up always going ways that we don't anticipate, but always interesting. So thank you for having me again on the Vetfolio podcast.
Yes, absolutely. And in recognition of course, the fact that this is audio and people can't see your background, that looks like
Hmm.
a super comfortable chair, and you've got this like
Yep.
beautiful lighting and some Vetahead, Petahead stuff. I'm like, oh, it just
Yeah.
looks like just sit down, a
Thank
comfortable place
you.
to have a conversation. Well, I'm excited because we're going to talk about chickens. And, of
Yes.
course, topical at the moment with conversations around avian influenza and backyard chickens
Hmm.
being very popular when we're talking about egg prices and things like that. But of course, that leads to people like me getting questions about what to do with backyard chickens. And most of the time, I certainly don't have the answer readily at hand. So I guess let's kind of start with
Hmm.
where do we start in general practice if we're getting these questions? How do we talk to owners about some of the common questions we might get or find good resources where we can help them?
That's an excellent question. And I want to start by disclosing that I'm not a poultry specialist. I'm ACCM, and we get trained on poultry too because they are part of the avian world. This is a very, very good question, Cassie, because I think as veterinarians in general practice, we get stuck in both worlds, right? Because when we're seeing chickens in our practice, we're not managing them as a flock. We're not managing as a poultry, a commercial
Right.
poultry, right? So all the knowledge that we might have learned at school, not necessarily, but like the poultry industry and all the diagnostics that we're doing are heavily based on necropsy, right? So when we come to the backyard chicken world, as you said, they're coming to us as pets or a hybrid as a pet, and also we're consuming their eggs. But we no longer can offer this resource necessarily to make diagnosis based on necropsy, right? Because that owner is bringing that patient to us as a pet. Different if a one of the chickens ended up passing away. Of course, we should be offering necropsy, which might not be something standard that we offer for dogs and cats. But you can get a lot of information there for necropsy, sending to labs that specialize on it. But then again, becomes very difficult for us all these questions because a lot of the laws for poultry do apply for us in general practice dealing with chickens as pets because no matter what, no matter if they are walking in a Louis Vuitton bag, which does happen with their owners, is sleeping in bed with them, or if they have the most beautiful housing castle, they are indoors, they still consider food animals. They still consider poultry. So as veterinarians, it's very important to say that we still need to oblige to all the rules and regulations. So that's number one. And I think regarding to the avian influenza, we have concerns as veterinarians, not only they spread from bird to bird, but also they spread to cats,
Right.
to cattle, right? And to humans.
Hmm.
So we need to worry about that. And I think a great source of information for updated information, know how the disease is spreading, in what states, know what advice to give to our owners is going to be the CDC. So on the CDC, as veterinarians, we can go there and get information. So you can choose and get information specifically for veterinarians that will talk about diagnosis, treatment. It will talk about where the disease is being endemic, because that's going to really highly impact how we advise our owners, right? So if you're an owner that is in a highly endemic area right now and you want to get a new chicken, I might advise you not to, wait for this to be more under control. So those are important information, but there's also a whole session for owners that talks about PPE for owners, how to put in PPE, how to remove PPE, which as veterinarians we receive training, but owners don't have, right? How to do sanitation, how to recognize signs. So I think it's a great source for us as veterinarians too, to know how to recommend those and make those advices to the owners. So I would say CDC is a big one. A second one, and of course I'm gonna have to talk about it because we
Absolutely.
we build it at VetaHead. As you know, VetaHead is a resource, everything you can possibly need for zoomato exotic animals as a veterinary professional. So a veterinary technician, etc. We have it all for you there. One of the things we have are online courses. They're race approved. And we came up with a whole pet chicken course exactly because we fall in that middle, right? If when you're studying poultry, there are excellent poultry books out there. When I say poultry, I'm more talking about production, excellent resources out there. But when it comes to pet chickens, then now we are having to collect blood, analyze blood tests, so hematology, biochemistry, that you're not doing that with poultry, right? Production. We're now having to do x-rays. We're now having to sedate them to take x-rays. Now we're having to evaluate x-rays. Now we're having to do surgery. Now we're having to do all of those things that we don't learn for commercial poultry because we don't do that, right? And so it's in between poultry medicine and also Zoomed exotic animal medicine. So we came up with this course, which I highly advise. We even talked about avian influenza. We talked about clinical science, diagnostics. We talked about how you perform a necropsy if you want to do one. Sometimes you are going to a farm that has a small flock or a small house, etc. How to put your PPE, what is the PPE, all of that. We talk about regulation. So I think it's a very good resource for general practitioners and technicians or vet assistants to go for our course on backyard chicken, because we'll teach all of that too.
Absolutely. And I'm so glad that you did bring that up because, if it's the caliber of so much of the other
Mhm.
material that I've seen come from Vet Ahead, then, it's something that we really need because, like you said, we kind of have our foot in both worlds here of where we're technically treating a production animal and we
Yeah.
need to be aware of the legislation around that. But we're treating this production animal as a pet. So we need the other side of that as well. So thinking about this course and going through the backyard chicken course, if we take this course and we say, all right, I think, I have enough of a handle where I want to give this a try. I want to start seeing chickens in
Mhm.
practice. Where do we get started doing that?
I would say this. I would say the chicken is the perfect word to get started. Because
Yes.
they're dogs with feathers in a sense of their behavior. Like, it's just like they are sweet, they are loving, they are intelligent, they have huge personalities. Like, one chick is not the same as the other one. And I just love that. So I think as a clinician, like talking about medicine, restraining them is very easy. Right? They really can't hurt us like a parrot can, really hurt your finger or something like that. And I think it is a great starting bird because you're gonna get familiarized a little bit with bird medicine and still be very easy transition, right? Because their restraint is very easy, collecting blood from them is very easy. They are a bigger animal, like, so they're not tiny birds. So I think all of that really helps us as clinicians to get started in the bird world. There's not a lot of extra equipment that you need when you're already seeing dogs and cats. When you're seeing a chicken, yeah, you might need to get a gram scale to weigh the smaller ones, a piece of equipment here and there, but there's not much that you're gonna need when you're seeing chickens, and you're gonna use a lot of your knowledge. I would say that 95% of the knowledge you need to see chickens you already have as a dog and cat clinician. I think it's a great way to start. We also have on the course the list of equipment you might want to consider purchasing extra, but it's not much. Like, it's really all of us have some sort, shape, or form of oxygen cage in our practices, right? Because we were seeing the congestive heart failures, the pneumonias in dogs and cats. All of us had some sort of heat support. A lot of us, like bear huggers, I think, or the heated blankets, I think, is very well disseminated. Those are great for birds. The things that are a little bit more particular, perhaps, is like crop tubes, but then chickens make it easy for us because we don't even need to have the metal crop tubes because their beaks are soft. They won't tear a red rubber. So we can even use the red rubber, which is usually what I do. So when you think about it, it's not like we're going to use the same ECG when doing surgeries. We're going to use the same pulse ox, the same blood pressure cuffs. Everything is the same, right? I believe, for example, we might need some specific endotracheal tubes. But again, that's just a very small thing, not that much more. I will say, though, when we are starting, very important, Cassie, is when we're talking about rules and regulations pertaining medications. I want to stress this out to our colleagues out there that there are some drugs that are prohibited in food producing animals, especially in chickens. Fluoroquinolones is one of that. So our famous enrofloxacin, we really cannot do it, any type of fluoroquinolone, even eye ointment or eye
Oh,
drops.
really?
Yeah. So
Okay.
those are, and that's because of human consumption, right? And I know that these chickens are not going to be consumed by humans, but if you see, one is the egg, so the drug in the egg, and if you say no, I don't consume the eggs, which a lot of people don't, they have the chickens just as pets, but you still have the argument like if your chicken escapes and
Mhm.
ends up in someone's backyard. So is the rule regulation, if it's right or wrong, I think it's not the point here, but we still need to obey it. And the other point, so enrofloxacin is just an example. We do have the list on VetAhead, which ones are prohibited, but also online CDC, great place, or FARED,
Sure.
I should say.
Farad, yeah.
FARED, yeah, FARED is a great source for that. The other thing is withdrawal times. Because when we are prescribing medications to dogs and cats, we're not giving withdrawal times, right?
Right.
So this is going to be a part of it here. So withdrawal times, what that means, and when our chickens, we're mainly talking about eggs, is basically, okay, you prescribe trimethoprim sulfa to that chicken, and now you need to tell Miss Smith, like, how long she needs to withdraw the eggs. So she cannot consume those eggs or sell those eggs, or even have the other chickens eating those eggs. So that chicken's going to need to be separate so you know which eggs belong to that chicken so you can destroy them, because that means that the egg's going to have residues of that medication and we can't consume that. So some drugs have withdrawal times, but a lot of them don't because we use them extra label. And so we need to request FARAD for it. It's a simple form. We also teach step by step how to do it. I know it might seem overwhelming. I promise you it's not. And they respond very quickly. And it's something that even your assistant can do. You know, it doesn't need to be you doing it. It's a very simple form. It's super intuitive. But that's another thing that I would say when getting started is to have in mind.
Yes, I remember in some of our classes in vet school, our food animal professors, they said, I don't care if that person swears up and down to
Hmm.
you that this
Yeah,
is not for human consumption. It doesn't matter. Your withdrawal times and your medication restrictions still
yeah.
apply in any of these species.
Yes, exactly. And it's always good to be rechecking them because they might change, right? For I might change a little bit, etc. Another very big one, and I'll say this because in the Zoomed World Exotic Animal Medicine, we use a lot hormonal therapy in the form of an implant. So, for
Sure.
example, I have an African gray parrot, it's a female, and I don't want her laying eggs. I don't want to mess with that. And so it's very routine already to preventatively place those implants. They are GnRH analog implants or hormonal implants, and you place under the skin. It's beautiful, like a microchip. Less, it depends on the species, like six months to a year or more, and then it will solve, and it does solve a lot of problems in our chickens, right? Because it gets to a point that we want them as a pet, as pets, and we want them not to lay eggs. And there are studies out there showing that it does work in chickens. And you go like, problem solved. However, the catch here is that we cannot use hormonal therapy in chickens. So it's prohibited, cannot be used. And again, to your point, I don't care if the person swears. It's like, I will never do it. I will keep it locked. We can't do it. We cannot really do it. So that's something to keep in mind in consideration.
Sure, sure. I'm also thinking, even if we do have this person who swears up and down this animal is not for consumption, like you said, what if, this chicken
Yeah.
escapes? Or I'm thinking of like wildlife exposure because of course we
Yes.
have those tragic cases where something breaks into the pen
Yes.
or a chicken gets loose and gets
Correct.
attacked or something that now we're potentially exposing wildlife. And I know just thinking from the dog and cat side of things, when we talk about euthanasias and things like that, there are big rules around burying animals and things like that for wildlife exposure. So keeping everybody safe here.
Yes, and those are the reasons. And I know it can be frustrating. A lot of times, like I have had chicken with infections that we do culture sensitivity, and the only sensitive antibiotic ends up being rofloxacin, and it breaks my heart. But like we can't really
Right.
do it. We need to obey that. But aside from these rules, that not many, and again, we have all the resources ready for you because it can be overwhelming when you're trying something new. And I think that Foley is great on that too. Like I had to go back and doing some shifts with dogs and cats. I had to do some overnight shifts. And I will tell you, like, I use Vet Foley because you go there and I was like, it
Yes.
has been so long. And I'm like so scared. And it was great for me because now I can remember how I felt in the beginning when I was doing Zoom Ed, and I how all of you, all of the general practitioners feel when they need to see a chicken, for example. It is scary. It is scary. So I think having all and Vetfolio again was very useful because you go there and you get all the information, all you need to do in one place. And you know it's updated. So the same with Vet Ahead. I think what we're trying to do is take that work and that, overwhelming amount of information, condense in things that we can understand is easy is what we need. And the resources, like this is where you can find this is where you do this is how you request. And when you do it, it's a magical world. Like seriously, seeing chickens is a magical, magical world. Again, they are easy to keep on fluids. They don't want to destroy the fluid line.
Oh, love that. It's more than we can say for cats.
Right? You place it on the leg again, which is a bonus in a bird because they have long legs. So you can place that. You tip just like you tip for a dog or for a cat. They are happy going
Oh,
around with their tube, with their fluid line. They don't destroy it. They don't mess with it. They don't tangle it, and they are happy campers. And that for the most part, they are not super stressed out. It's easy to restrain. Collecting blood from them. Seriously, you have them on the table. You lift their wing and collect from the owner vein. It's like, magical. So I love it. I love it.
well, and I want to go back to what you said about working those overnights with dogs and cats. I feel like that's so empowering. That paints such a good picture because, here you are with, DVM, you're a
Hmm.
diplomate, you're master's,
Hmm.
PhD, and you're telling us that after years in practice, you're walking back
Yeah.
into this environment going, "Oh my goodness, I'm nervous. I'm afraid that I don't remember I don't know what I need to know and something's going to stump me and create a problem
Yes.
here." And
Yes.
yet, you did it. You used your resources and were successful. And I think
Yeah.
that just kind of paints that picture of if we do want to start seeing chickens, there are these wonderful animals, and we don't necessarily have to be able to answer every question and know every condition just to get started.
Yes, and that's the reason why I share. And I will be very honest and vulnerable here. At the same time, I was very fortunate to be able to go on a website and apply for those shifts. It's scared. I was very scared because I have not practiced dog and cat medicine 15, 20 years, right? I have my own dog, but just so you know, I'm not their vet. And so that was very scary. As much as I was very privileged to have that resource, it was very scary. And I was even afraid of not being sharp. I was afraid to kill a dog or a cat by not making a correct diagnosis, by missing something. Be very honest with you, like I was like, do I even know how to hold a cat? Like, or and it was a little overwhelming. And I would like watch or listen to the Vetfolio webinars and things on my way in there, on my out there, like the more common things on emergency, the like for cats, for dogs, for this, for that. And I was like, okay, I think I got this. And you know what I found out? It's the same.
That's
It's
such
the
that's
same.
something you drive home so much with Vet Ahead of,
Yeah.
we're approaching animals the same way, and the conditions that they have, the anatomy is different from species to
Yes.
species, but the approach doesn't change.
It is the same. So you know what I did? And this came from a very good friend of mine. She's an emergency doctor for like over 20. She's brilliant. She's like Dr. Michelle Chin. Shout out to her. She so I one of my first shift, I called the way they're crying. I said, Michelle, I think I can't do this. I can't do this. Like I my biggest fear was to not save an animal and
Right.
impact the family. Like it's a lot of responsibility, right? And she turned to me and she kind of slapped me on my face with my own device, just like, I want to pull it together and pretend it's a rabbit. You're going to go there and you're going to say, this is a rabbit, this is a rabbit. And if it's a cat with respiratory problems, you're going to say, this is a bird, this is a bird. And you're going to manage them the same way. I'm like, okay, I got it. Because that's what I tell everybody. Pretend it's a dog. What would you do? Pretend it's a cat. What would you do? And Cassie is the same. I could
Wow.
not believe it. I was like, it's a rabbit. Okay, what about you? Okay, I'll put the ultrasound here. I will do this. I will do that. I will do X-rays. I will do this. I will do that. And it was just like I felt so empowered after all of this. If you were doing all of this with dogs and cats, guys, chickens is easy,
There we
easy.
go. And again, I think it circles back around to being so empowering to, when we do get that phone call to say, "Hey, can you help this insert species that we don't normally
Hmm.
see?" To say, "Okay, it's a cat, it's a dog, it's a neonate or a geriatric or, whatever category you want to put on it." And to really approach the medicine in the same way, and then use our
Yeah.
resources to say, okay, well, it's an
Yep.
endocrine problem. What are the common endocrine problems in a chicken? Or I don't know. I'm
Yeah.
speaking out of turn
Yeah.
here, but
But you're right. That's it. I will give you an example very common in chickens. Okay. So chickens, it's very common for them to have egg coelomatis. So basically what that is when they ovulate from the ovary, the the follicle is nothing but yolk, right? So imagine the yolk with that very thin membrane right in the egg. So
Sure.
that's the ovary, a lot of tiny yolks with that thin membrane. And so that yolk goes into the oviduct, which is the uterus. And when it's traveling through the uterus, that's when you receive the white part, the albumin, the shell, et cetera, et cetera. Sometimes that follicle, the egg, will be laid in the coelom instead of going inside of the oviduct, right?
Sure.
So now you have the yolk in the coelom, and yolk is very sticky, right? I'm gonna make like it's almost like have bio in there without a pH, etc. But
Sure.
it's
I'm
a
thinking
sterile
like an
thing,
acute abdomen, a septic abdomen or something like
right?
that in
It's
a
like
dog.
yeah, it's like a peritonitis in a
Sure.
dog. And it can be sterile, it can be septic. So now you have the chicken coming to you with a very distended coelom, or it's the abdomen. They don't have a diaphragm, so it's called the coelom. But it doesn't matter the nomenclature, like semantics, right? It's a distended belly, and it has a fluid wave. It's very easy for you. It's like, okay, it's fluid, right? And the chicken can barely breathe. And so it's the same concept, right? You have an effusion. So if you really, I really I cannot stress enough. Tell yourself, this is a dog, this is your dog, this is a dog, this is a dog. And then you throw your probe in there and you see a lot of liquid. What would you do? I'm going to tap,
Right.
right? I'm going to tap because that's what I would do in a pleural effusion in a cat, right? If they need to breathe, I need to tap that thorax. Otherwise, they won't be able to breathe, right? Oh, but it's going to die if I tap. Well, it's going to die if you
Gonna
don't
die if you
tap. That's
don't.
why in the cats, we lightly sedate them, we put them in auction, right? And then we tap them and we do it. That's the same with the chicken. But the chicken is even better because a lot of times you don't need to sedate it. And it's so pendulous that you just gravitate and you go there with your ultrasound and
Love
you're
that.
gonna collect all the liquid and you immediately you're gonna see that chicken breathing better. And you're gonna collect sometimes 100 mLs or more. So that's a good example of pretend is a cat with effusion, right? And what
Sure.
would you do?
Yeah, that makes sense. Now I'm curious about the coelomitis. Like, do these need,
Yeah.
can you tap and will this resolve once you get the fluid out, or do these need to be flushed or
Amazing question. So just like a dog with peritonitis, like the tap is going to be therapeutical, but we need to get to the source so it doesn't happen again, right?
right?
So if that was caused because of the ovulation of the ovary into the coelom, that follicle into the coelom, so meaning it was not an infection in the oviduct, it was not a problem in the oviduct, it was not cancer, which is unfortunately common on them on the reproductive tract, then usually when you do that, if there's a lot of yolk, we might have to go to surgery to flush, just like you do for peritonitis. We might need to do that and remove that foreign body, which is the yolk now, and that could be curative. Now it could happen again, but it could also be curative. Now, if we're dealing with cancer, that's why, again, if you're evaluating the fluid afterwards, sending for analysis cytology, or for example, if you are doing other diagnostics such as CT, ultrasound, etc. You can see a mass, for example, etc. So you will know to give a prognosis. Then of course that's going to be temporary and we're not going to be able to cure it. But if it's also infection in the oviduct, then we spay them. So then we go there and remove that oviduct. Important to say this is a distinction. Their ovary looks like a bunch of grapes together, but it lays so close to the renal artery and vein, and so removing the ovary, it's actually very risky. It's a 50% chance of the bird dying of hemorrhage. So it's not a common procedure we do, but removing the oviduct, it's a common procedure. And so we can also, so egg infection, so like they lay an egg, that egg for some reason does not develop completely, does not get laid, and then they have another follicle which starts impacting one on top of the other. That's very common. And so we would remove the oviduct, yeah, so they can have an extended life with quality.
And now, well, okay, so now I'm picturing we have this ovary and now we've removed the oviduct. But when we were talking about the egg coelomitis, we were missing the oviduct and ending up in the coelom. So what then happens to those follicles?
In theory, if they are like laying normally, it could be absorbed.
Okay.
And it could also be absorbed before it's laid, but it's always something we tell the owner. See how you don't know about chickens, you're already
Y-
getting the critical
You're
thinking,
painting, yes, like the picture is
right?
coming together, everything you're
So that
saying.
what we will say, and that's when the GNIH implant will be magical because you
Sure.
could stop the ovulation, but we can't do that. So I always tell the owners like this might lead to a coelomitis in the future, and it might not lead. And a lot of times when the chickens get older, they stop ovulating and they stop
Sure.
laying eggs and ovulating. So it all depends. It's a patient that you're gonna need to monitor, but it's definitely possible. And they are very strong animals. I would say that chickens are very resilient. Again, a great candidate for you to start doing surgery in birds because they're bigger. So intubating is piece of cake. You can do everything the same. Blood pressure, the values are going to change, but how you acquire blood pressure is the same. The cuff is going to be big enough. ECG, all of that. You're going to do SpO2, capnograph, all of that is way easier than if you're doing like a little paralet or something. So great one to start. The organs are going to be better.
Sure.
Everything's going to be bigger, more difficult to hit things that you don't want to hit, So I think it's a great candidate for you to start.
And now as I'm continuing to put the picture together, we talked
Hmm.
about coelom because they don't have the diaphragm and intubating. Of course, if we have a compromised diaphragm in a dog or a cat, then we really need some serious ventilation support, and that's a snowball effect that can happen. What happens when we intubate this chicken and then we open up the abdominal cavity? Hopefully, people listening aren't like, "Oh my gosh, Cassie, what a ridiculous question."
It's
Um,
not ridiculous.
but yeah, so is it manual ventilation?
What happens? What is connected to the lungs? The air sacs.
Right.
So now, when you open the coelom, inadvertently, you're gonna damage some air sacs,
Okay.
right? So now the air is coming through your trachea, through the tracheal tube, down to the lungs, and it is escaping because you made an incision. So you poked a
Right.
hole. It's like, the air sacs are balloons connected to the lung, and now you poked a hole in one of the balloons, right?
Sure.
So it makes a lot of sense. So yes, you're gonna have to ventilate those patients for the exact same thought, right? Okay, it's not the diaphragm, but now you have the air sac. So that's what I'm saying. The medicine is the same. You're gonna need to mechanically ventilate that chicken because even if that chicken is breathing on her own, the ventilation might not necessarily be occurring, just like in a dog.
Sure. Like the VQ mismatch.
Exactly, right?
Ah.
So now what do we need to have monitoring to know if that ventilation is being appropriate? What would you do in a dog or a cat?
Well, I'd say
What would you monitor?
SpO2, and then probably ideally we'd be looking at blood gases if we could, but at very
But
least
even
getting an
simpler than that,
SpO2.
and tidal CO2,
Oh,
you want to
sure.
keep it
Okay.
between 35 and 45, right? So if it's above 45, you need to ventilate that chicken more or the dog or the cat, doesn't matter, right?
Okay. Sure.
Isn't that so cool? So
It is.
that's exactly it. You will need to ventilate it. And usually when I'm about to go into the coelom, I always tell whoever is anesthetizer side, that's when you're going to start hating me right now because you're going to need to start ventilating. And when you do it, and also when you rupture the SX, it's totally fine. It will heal afterwards. You're not going to have breathing problems afterwards. But another good thing is because the air sac is connected to the lung, you just need to be careful when you flush in the coelom, right? Because you don't want to
Sure.
instill that saline to the lung. So we always make sure to keep some angle, right? So the head a little bit above the rest of the body, and also like not to flush very rigorously. You should flush, you can flush, but we try not to put that fluid into the lung. So it's actually very cool.
That is very
Yeah.
cool. And yeah,
Yeah.
that was like you said, we who knows where these conversations are going to go, but I
Yeah.
think that was such a good example of the medicine is
Yeah.
the same. The concepts that we're working with are the same regardless of what species we're treating.
Yeah, and just for disclosure to everybody, we have not talked about this scenario. It's not that we had it arranged for you to to come to this conclusion. It's just because you're using your veterinary brain.
Yes, yeah. Oh no, this was
Yeah.
100% organic
Yeah.
of like, wait, but I have
Yeah.
another question. And
Yeah.
and I'm so
Yeah.
glad that we talked about it because I think it drives that point home so well to just acknowledge the unique attributes of the different species, but that the thought process can really get you 90% of the way.
And I would say too, like people are usually scared of sedating and anesthetizing birds, right?
Right.
A lot of times within reason, I would say, especially if it's a small animal and a small bird. And then I always often try to change because words have power. So it's not difficult to anesthetize a small bird. It's difficult to anesthetize any small animal. Because if you have a kitten this big, guess what?
Oh
It's gonna be
gosh.
difficult because you can barely monitor, right? You
Right.
have ECG and SPO2, but that's about that. Like if you intubate, if you have a tube that is small enough, maybe you have entitled CO2, but also you add in dead space and you can't do blood pressure and it's very so I really strongly advise people to, instead of saying it's difficult to anesthetize births, it's difficult to anesthetize a small patient. With that being said, I think we forget that we can monitor everything we monitor for dogs and cats, and it's the monitoring that will make us feel comfortable. So for example, when you're sedating or anesthetizing a chicken, having the ECG connected, so like the heart rate, you can see the ECG, you can see the wave lines, so that's going to give you a peace of mind. Second thing is monitoring SpO2. The chickens make it so easy for us because it's not all birds that we can have an accurate SpO2, but chickens have the wattles, and so you can just clip there.
Love it. Love it.
So CRT also you're going to do there. You press it, and then you're going to see the same thing as you would do the CRT on the gum. It will be the same. So I'm telling you, chickens are like parrots are not going to be that easy to do, right?
Makes sense.
So chickens upgrade. So you put your SpO2 probe there. Again, the blood pressure cuff, you can either do the leg, the thigh, or you can do the wing. And usually we would do oscillometrics. The wing you can even do with the Doppler. So that's what I say. When you are anesthetizing that bird and you're monitoring all of that, say we intubate and we are using isoflurane, okay? And then you see that the blood pressure starts to decrease because you're monitoring, right? So what would be your thought? You have a dog that is becoming hypotensive and is on ISO, what would you do?
Well, I guess I'd evaluate depth and see if I can turn down my ISO or administer max sparing drugs, and then look at fluid boluses if it's appropriate. And yeah, but mostly try to get that ISO down because I feel like that's where we lose a lot of blood
Congratulations, you a
pressure.
chicken veterinarian.
Yes.
You graduated. So it's the same. But here's what happened. When we are not monitoring the blood pressure, you don't know that's happening. And then the chicken's becoming hypotensive, then you don't know. And then suddenly the chicken dies. And you go like, darn it, chickens die. Chickens don't die. It's because we were not monitoring and we couldn't prevent or mitigate that. But you see, when I tell you, if you have a blood pressure and the blood pressure, you already immediately you know what to do. I need to decrease my ISO, right? I either need to give other drugs to keep this patient anesthetized and use less ISO, or if I already corrected that and that was not the issue, do fluid boluses. And if the fluid boluses don't resolve, then I can think about hypertonic saline, then I can think about colloids, then I can think about pressors.
Yeah.
But the way we're going to do is exactly the same. But the key is in monitoring that, right? It's the same as masking down. If I'm masking down a chicken and not intubating, I lose the entitled CO2.
Yeah.
Which is like a game changer, right? For any anesthesia and any animal. Because now I know, like, just looking to see if it's breathing is not enough. I need to make sure it's ventilating properly, right? So monitor. So birds are not difficult to anesthetize. It's because we forget we can use the same monitoring.
And the same techniques and thought processes that get us through in some of our really critical dog and cat patients.
Exactly.
And I love that you bring this up because I've heard you talk about this before, and I thought this was such a good point where you've talked about this in rabbits and said, oh, kind of the same thing. Oh, rabbits die. No, we're not intubating them and anesthetizing them properly. And you mentioned that there's some simple equipment that we can keep handy in order to be able to intubate and monitor correctly and all of this. And it sounds like in chickens, it's pretty similar to what we would be using anyway. But I'm curious with Vet Ahead, are those lists on there too of here's what's going to make your life easier if it's not a chicken and it's a rabbit or another similar example?
Yes. So to answer your question, the other thing I really want to make it clear to everybody is that Zoom Med should not be scary or expensive in a sense that you don't need a fancy scope. Like, and then if I had, we do teach you, yes, if you want to get we have a list of equipment for you, because to intubate a rabbit, you do need visual aid. You need something to help you see. Because the mouth, different than the bulldog, you open the mouth, you can see everything. Like the mouth opens, like the rabbit has a very small opening for the mouth and a very long oral cavity, right? So that makes it trickier. However, you can use a camera, and that's literally what a scope is a camera. Sometimes I even don't say scope, so I don't want to scare people, because you say scope, you immediately think about something super expensive and I don't know how to do and it's complicated. It's a camera. Nowadays there are scopes that you attach to your phone.
Right.
And they are cheap. So I have a whole lesson. We have a whole lesson in there teaching step by step how to do it, and a whole lesson about how to intubate rabbits on the cheap with instruments I actually bought off of Amazon.
That's what,
Yeah,
and that's why I wanted to bring that up because I remember you talking about the camera, getting that off of Amazon, and I think you were also talking about a capnograph machine that you
that
had
I got off
found,
Amazon, $264,
which is crazy.
which it works.
Oh my
It's
gosh.
like, yeah. Did you know there are cameras on Amazon that cost $30 for you to clean your own ear?
Yes, because I have worked with another colleague who ordered it and she kept it in her desk drawer when we worked
Yeah.
together. And so she would show owners what was in these dogs' ears if they weren't convinced that we needed to do something.
Yeah, so that thing connects via Bluetooth or Wi-Fi to your phone and is a little like it looks like a little pencil. And what I do, because on the very tip of it, it has like a scoop to clear wax. I just break that and I file it so it's smooth. And you can use that as the camera, look into your phone or your computer, whatever, to intubate the rabbit. Because literally all you need is an aid to aid in visualization. Like you can see down deep down there. So you can use that. Okay, guys, we have like cameras that go inside of the pipes. Like,
Right.
why would so we can use something cheap like that, or we can use something like I bought scopes, rigid scope for $200 off of Amazon. A camera that connects directly to my computer. Like, I think it was like 300 too. So again, there's so much that we can do on the cheap nowadays, very different than when I started 20 years ago.
Hmm.
Like when I started, it was just the fancy, like stores equipment and like very unapproachable. The first scope equipment I bought in 2009, I bought refurbished. And I remember it cost me $12,000.
12,000.
And it
Oh
was
my
like
gosh.
simple. Yeah. So, and again, but nowadays, it's not like that.
While I am like restraining myself from asking you 15 more questions, I'll just wrap it up with what did we not cover? Are there things that you want to make sure we share before we wrap up here?
I think the one thing I want to share that we've been working on something that's going to make everybody's life so easy. I've had a head with ZoomEd, and we've been working on this for over a year. Includes AI, includes a lot of easy access to information, involves an app. Now with AI that we are incorporating a lot, the tools that the AI can find it for you, give the answer there for you. We're going to have a lot of calculators that you just input, like to know how much critical care diet you give to that patient in the hospital. We're going to have for CRI. So you were talking about sparing effects. So like you
Right.
want to do fentanyl in a chicken and you put the weight, because people are scared to do CRIs. They
Hmm.
calculate CRIs and it's going to calculate everything for you with the
Amazing.
doses. So I definitely want to put this out there. Something huge is
Absolutely.
coming. Yeah.
Yes, absolutely. I mean, if you haven't checked out Vet Ahead, it's such an amazing resource. I can't say enough good things about it.
Thank you. Yeah, VetaHead.vet. Go there, become a member. When you become a member, you have access to all the courses, all the resources, all the calculators, everything. VetaHead is all for general practitioners and technicians.
Yes. Oh, I feel like it fed this conversation so much because
Yeah,
everything that you were describing is, yes, exactly my feeling. And thank you so much for sharing that
of
experience.
course. Yeah, thank you for having me. Thank you so much.
Lila, it is always so much fun to have the opportunity to talk with you. I'm just blown away every time. I truly, truly enjoyed it. Thank you for joining me. A big thank you to everyone out there who tuned into this episode. If you have not checked out the Vet Ahead platform, I would highly recommend it. It's such a cool platform that Dr. Proenza has created. Just fantastic. So, highly recommend you head over there and check that out. It will absolutely be worth your time. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals out there find this and other great content we try to create. If you enjoyed this episode and you'd like to hear more episodes, you can click on the education tab on the Vetfolio website or find us wherever you get your podcasts. As always, we would love to hear your input on this talk as well as ideas for topics you'd like to hear from us in the future. So you can feel free to reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.